But I want to talk about this with Dr. Megan Ranney, who joins us now. She's an emergency physician and dean of Yale's School of Public Health. Great to see you. Can we just start with how big of a health concern is this right now? How are you categorizing this in your head?
On a scale of 1 to 10, this is somewhere around a 3 or a 4. Now, this is the biggest cyclospora outbreak that the United States has ever experienced. It is a really unpleasant illness. To be explicit, it is explosive diarrhea that comes and goes for weeks on end. But it's not, by and large, a super dangerous parasite. For most people, excluding the elderly or the young or the immunosuppressed, for most people, it is just unpleasant, and it is easily treatable. There is a very common, inexpensive antibiotic that eliminates it once it's been diagnosed. What I do find concerning, and why it's not a 1 or 2 in terms of my level of concern, is because of how big this outbreak has been and because of how long it took us to identify the source. That makes me worried, just as in the very early days of the hantavirus epidemic, or hantavirus outbreak, it makes me worried about the capacity of our nation's public health system and about how we would handle things if there were a super serious, super dangerous pathogen here in the United States.
So let's get into that a little bit, because look, this illness did hit a lot of people in a very short time across many states. How does something like that happen, and where do you even begin to sort of peel back the path, the contact trace, in a sense, of where this may have originated?
Yeah, so cyclospora is a little bit complicated. There are lots of foodborne illnesses. Most of them show up within 1 to 2 days of eating or drinking something that's contaminated. For cyclospora, it takes 1 or 2 weeks before you start getting symptoms. And then on top of that, we don't normally test for cyclospora in the doctor's office. If you come in with those stomach upset symptoms, the doctor has to actively think about it and actively order the test. So it makes it tougher for us to even start to see the signal that there is a cyclospora outbreak. And then finally, that process, as you said, of figuring out where it came from, that requires what I call shoe leather epidemiology. It requires there being trained public health professionals who go and talk to the people who have the infection and try to figure out what it was that they ate, look for that signal of the common food or common drink between all the people with the infection, and then go back and do the testing of the site. Now, because so much defunding has happened at the CDC, at the FDA, and then with a trickle-down effect for state and local health departments, that process was slower this time. We have fewer trained experts out on the ground, we have less coordination between the different agencies, and we have less reliable national counts of disease than we would have had 2 years ago or 6 years ago or a decade ago. So that's what has made this outbreak a little more complicated, and again, what gives me some concern about the future.
And, you know, in terms of what comes next, obviously, you know, we've gotten some clues as to the supplier this came from, some places where people may have had this lettuce. You know, it provides at least people some context. But then the next question becomes, well, when can I kind of go back to eating shredded lettuce in the way that I was before, or the iceberg lettuce in the way that I was before? How soon can people feel safe about doing so? What is that time frame typically like?
Yeah, so Taylor Farms, as you said, has recalled all of this lettuce. It's going to take a little while potentially for it to come off of the shelves. I would recommend to people that they avoid eating that bagged shredded lettuce for a little bit longer, a few more days, another week, and then they can go back to eating it. In the meantime, eating other brands, locally grown lettuce, hydroponically grown lettuce, all decreases your risk. I think for all of us, this serves as an important reminder that being healthy, eating healthy food, is about eating nutritious food for sure, about avoiding chemical additives, which is what a lot of the current federal government has been talking about. It's also about having access to food that is not contaminated with disease-causing organisms. And that requires a significant system in place to make sure that we all stay safe. So for viewers, you can go back to eating lettuce, be careful about where it comes from for right now, and then go off and enjoy and eat lettuce, eat fruit. If you are one of those people in a high-risk group, make sure that you're careful about washing your produce well.
Dr. Megan Ranney, whom I've spoken to many times on CNN, but only met for the first time in person this week. So it was great to meet you in person, and thanks for taking the time tonight. Good to see you.
Thank you, Omar. Thank you.
All right, still ahead.